We first answer the question that we addressed last when Duncan Stewart was talking about it in terms of the patient-oriented research, and you asked whether there is enough money. And there is never enough money. It's a very costly proposition, and it has to be resourced properly. But what's very interesting is that the Canadian Institute of Health Research, which is the main funding body of the Canadian medical research, has just identified patient-oriented research as their top priority. So this is a very positive step forward, although they haven't put in more money into the system as yet. The future money is going to be directed towards it because they all recognize that this is where we need to go. But let me talk to you about a little bit about the research that we do at the Royal Ottawa Hospital, or at the Royal, and the Institute of Mental Health Research there is focused more on mental health. And the good news story about where we are going there, as well as where we're going nationally, is the fact that mental health now is coming out of the shadows. We created the Mental Health Commission of Canada, recognized the importance of mental health, and we're now starting to address mental health like we do other illnesses, rightfully so. So, for example, what we have done at our campus is we built a brand new facility which is not hidden away behind the recesses of the old TB sanatorium of institutionalization. We have come forward right on the street, tall buildings, clear, transparent glass. We're open and in your face. We're there to address the issue of mental illness, which is right now, after cardiovascular illness, it is the most largest burden of illness. And we're spending less than 5% of research dollars in such a major issue. So the good news is that we're finally beginning to treat mental illness in the way we should be treating it, just like we did with cancer when it was a silent C word that nobody wanted to talk about. We now have steps where you can diagnose cancer by using scans, by taking biopsies, by looking at cell cultures, and so on and so forth. In mental health, we're starting to do the same thing, collecting information in a very systematic manner, and based on the data, using brain imaging, genomics, proteomics, and all the major tools, we're moving forward to personalized medicine, so we'll be treating patients for what they are suffering from rather than in a global trial and error method. And nationally, it's the same thing. Because of the Mental Health Commission of Canada, we are first now recognizing that it's an issue of national importance, and we need to get coordinated and organized to bring mental health to the fore, which is happening slowly but surely.